Happy Monday, everyone here. Todd Houghton here from Houghton Physical Therapy, here for another episode of Facebook Live. Episode number 51, You Can Be a Lifesaver, Signs and Symptoms of a Blood Clot and What You Should Know to Maybe Save the Life of Someone that you know. So in this episode, you're going to learn the top 10 things to look for if you or a loved one may be having a blood clot and what that means. My name is Todd Houghton here from Houghton Physical Therapy, back again for episode number 51. Excited just to add more value to you. And tonight, this episode came up when we had a patient that had come into the office, and one of our clinicians here, Adam, actually picked it out and recognized it, and we called the physician's office, and we were able to really help the patient out quite a bit. Please feel free to contact me at toddh@houghtonphysicaltherapy.com. Reach out to me on Facebook. I do reach out and I do answer back all the comments that someone actually may write in. Please feel free to tag somebody if you think that this might be helpful for them as well. I wanted to go over the top 10 things that could be useful in helping to find a potential blood clot in somebody that you may know. So we did have this patient that came in probably about 2 months ago, and he just had a knee injury. And when he had the knee injury, everything was going pretty well. He actually tore up his knee pretty good, but then he came in one day and Adam had noticed that things didn't really look right. So I wanted to go over kind of what we did. Adam called me over and we called the physician's office, and the patient actually had blood clots from his ankle all the way up to his thigh, and he actually had a pulmonary embolus, which I'm also going to go into. So it was something suspicious, and thankfully for Adam, he potentially saved his life. The patient was in the hospital for about 4 or 5 days. Now he's on blood thinners, and now he's doing well, waiting until he can get off the blood thinners to have surgery. So what is a blood clot? A blood clot is a collection of sticky blood cells that form due to a blockage in blood vessels in your body. Where does this blockage come from, or how does it start? Most commonly, it happens, few common ways, is someone takes a trip, someone rides on a plane for a long period of time, maybe going halfway around the world, where they sit and their knees are bent for a long period of time without much mobility. It can also happen if someone has had any type of surgical intervention, and again, they're sitting around a lot, they might have a lot of pain, they don't really want to get up, and they don't want to move. So typically post-surgery, long flights, and it can happen, as I talked about before, just someone who had a traumatic injury in the body. How does the blockage form? Well, the clot forms when the mass of the fibrins and the platelets are sent to an area to stop the bleeding when there's been a trauma after an injury or surgery. The body naturally usually dissolves this clot, but sometimes it can't dissolve the whole thing, or maybe there might be an external factor in which if your leg is bent, it kind of hangs out there and it actually can't clear it naturally. In some cases, it may be genetic. So there's a few different reasons why we couldn't clear the clot naturally. Why does a blood clot form? It can happen with active cancer, if someone is a smoker, surgery, pregnant, from an injury, cardiac conditions, or inherited blood clotting disorders. So what are the symptoms of a blood clot? Swelling, pain, tenderness, warmth, or redness in the area of the affected leg. And a way that we can commonly tell this in physical therapy is a lot of times we'll take some growth measurements just to kind of see and have a comparison. Now, if a patient had been in to see me before and I had a good idea of before they came in for maybe another lower body injury in the past, hopefully I would have growth measurements that I can compare it to. Especially at least on the initial evaluation, if the person didn't really have any swelling, I can take growth measurements and compare it to when they've come in complaining of these different, of any different swelling issues that they may have going on. So where does this blockage form? Typically it's in the lower body. There are some veins that come up from the leg as they return the blood back to your heart, but typically that's where they form, somewhere along the legs, anywhere down from the ankle all the way up towards the groin. Then we can get what's called a pulmonary embolus, and a pulmonary embolus is a blood clot that is in the lungs. So to go more specifically, people have heard of a DVT, a deep vein thrombosis, and that is a clot that forms in the deep veins on the legs, majorly in the larger veins, usually in the thigh area, where it's pain, tenderness, really red. But what's interesting enough is 50% of these people don't have any of these symptoms. So we really want to make sure that we're on top of our game. Again, a pulmonary embolus is when a DVT or blood clot, it throws a clot somewhere else and it comes up into the lung area, which it gets lodged in the lungs, and then that's really, really serious, a really serious health complication. So now we get to my favorite idea here. My favorite thing in the topic for tonight are what are the signs of a blood clot? So the first thing that we might see is some redness. Number one, we might see some redness in the area. So we want to compare it to the other side and see if there's anything that's different. So it could be redness in the calf, the knee, the ankle, could be in the foot, could be like a line all the way up towards the groin. So something to really be conscious of. So that's number one, is redness. The second thing that we want to look for is warmth. So we really want to compare the affected side that the person's coming in for, where we think that they might have a clot, to the other side. Now, if someone had surgery, it's fairly common that it might be a little bit warmer anyway, and they might not have signs of a clot at that time. So again, we really want to be really good with our assessment skills. But for someone just looking, you can feel down and simply feel, oh, it definitely feels better. It definitely feels warmer than the other side. Number three is unexpected or unexplained exhaustion. Say you've been resting all day and you get up and you just really feel exhausted, and the next day you feel the same thing. You've been really getting a good amount of rest, you've been sleeping good, been taking it easy, and you just feel exhausted. Another big sign. Number four is swelling. We're going to notice that the joint is a lot more swollen, because if we have a clot, then all the swelling, or the drainage isn't allowed to come back up and circulate through the body to get up through the heart and the lungs. They can circulate back throughout the rest of the body, and it gets stuck because of that clot. Number five is we might notice that some of the veins, like if you look down at your forearm or if you look at the back of your hand, you might see some veins. The veins in the leg can be distended. They might look really, really big or really, really thick. Number six is they might have a low-grade fever. So again, if you've had surgery, a lot of times the doctor wants you to take your temperature anyway. So you want to make sure that you've been doing that all along and look for a low-grade fever. It's just going to be just enough to be off. Number seven is calf pain. Really, really common that people have calf pain. You feel the calf, it's abnormally tender. Sometimes if someone has a knee, hip, or ankle surgery, a lot of times the calves are sore because they've been walking on crutches, they've been overworking them, but this is a different type of tenderness. Number eight is an increased heart rate. When the clot grows in size, the body has to try and get rid of it naturally, and if it can't do that, if it has to try and force through it, the heart rate might have to increase, because it's the body's perception that has to work harder to clear the clot because there's some type of obstruction. Number nine is dizziness. With a clot, you can feel a sensation of kind of whirling lightheadedness and kind of giddiness, almost like you're losing a little bit of oxygen. So dizziness is another big one. And number 10, someone might feel fairly common, is foot discomfort. My foot just feels really tight. It feels really sore. I've had a bout of gout in the past. Maybe this is that. Something to pay attention to. So hopefully this was helpful. 10 signs or 10 symptoms that you may be able to pick out for someone in your family if they've had surgery, friends, family, or yourself, that could save your life. So if this was helpful, please feel free to tag someone. Please feel free to reach out to me with any other topics or ideas that you would like to hear me talk about. Thank you very much again. Todd H at HoughtonPhysicalTherapy.com. Reach out to me on Facebook, and I look forward to seeing you here next week. Thank you.